All right, so now that we have covered all of that super fun and not at all boring information on the logistical use of CPAP, let's go over the more practical use. The good news is not super difficult to use, and we here in the North are blessed to have a CPAP that is very much a set it and forget it piece of equipment. It's very nice. It looks a little bit more complicated at first glance, but I assure you it's not anything to be intimidated by. So the nice thing about these CPAP masks is they fit exactly like a BVM mask. So we all know how those are supposed to fit. They come with the clips on the front that are meant for securing to the patient's head. You guys have obviously noticed at this point that there are two different sizes of CPAP mask, one with a blue clip, one with a red clip. If you're finding that you're just not getting a good seal on your patient, maybe it's possible you need another size of mask. So go ahead and give the other one a try. So when we're setting up our CPAP, I know I talk a little bit about it in the PowerPoint version of the presentation, but just as a visual example, we do want to really hone our skills on speaking to patients, coaching patients, because this is going to be one of those treatments that we know can make a huge difference for this patient, but it feels super counterintuitive for that patient who is probably already panicking and anxious and just needs a little bit of calm. So we're going to do a little bit of coaching. We're going to explain fully to our patient what is happening. So, sir, you're having a hard time breathing. We've already tried this non-rebreathe mask, which is just oxygen, and it's obviously not really helping you. So we're going to move it on up to CPAP. So you're going to explain to them what CPAP is. It's going to feel like you've got air blowing right into your face, which you do. It's going to feel a lot like when you walk outside on a windy day and can't catch your breath. So we're going to start really low so that you can get comfortable with it. You can offer the patient the opportunity to hold the mask themselves to their own face if that makes them feel a little bit more comfortable. We don't have to jump right to strapping it to their head. As I also mentioned in the video, we're going to start low and slow with CPAP. You don't want to just crank it up to 10 and stick it to the patient's face and strap it on there. And that is just a recipe for huge anxiety with our patients, especially when they're already having respiratory problems. So we can offer the patient that opportunity to hold it to their own face, slowly titrate up as they get a little bit more comfortable, as they start to realize that, oh wow, I'm feeling better. This is good. This is a good thing. It's not comfortable, but it's a good thing. After that, we can kind of say to them, hey, would you mind if we just strap this to your face now? That'll free up your hands. You can just relax then. You got to really sell it to the patient. And fortunately in EMS, we're pretty good salespeople. So I also mentioned earlier in the capnography video that now that we have our end-tidal nasal prongs, we can have those on underneath CPAP masks. So I've gone ahead and already outfitted SimMan with a CPAP or with an end-tidal nasal prong. So he is wearing it right now. We can go ahead and just stick that CPAP right over top, and then we're going to clip it to his head. So our CPAPs come with these nice, not at all gross felt straps. And what we're going to do is we're just going to attach them lightly at first, figure out our sizing for our patient. I think I've gone a little bit far on SimMan here. It's going to be a little bit tight on him. Sir, you're going to have to sit up just a little bit. Okay, so just as a loose fit, this is not too bad. When we're actually tightening it to the patient to make sure that we've got a good seal along the bridge of the nose, we're going to actually tighten the bridge part first, so the top straps first, and then we're going to tighten the bottom straps just to make sure that we've got a really good seal. Again, making sure to tell our patient every step that we're performing because we don't want them to get upset and anxious. We want to keep this as calm as possible. Once you have this CPAP on the mat or on the patient, essentially it's the only thing you really have to do at this point is just continue giving that supportive care to the patient. And we can also titrate the oxygen up if we're feeling like the patient's handling it well, it's having a positive effect. Maybe they need a little bit more support. When you do the research on these O2 CPAP masks that we carry, you get a little bit of a variation in what they recommend as the starting O2 dose. So I would recommend just starting at 5 liters a minute. You could start a little bit lower if you're feeling like maybe this patient might be a little bit difficult taking the CPAP. So we're going to start it at 5 liters a minute, and the end is actually just going to plug into a normal oxygen tank or your normal oxygen delivery system. There is no pressure manometer on these CPAP masks, which is super nice and why I tend to call it a set it and forget it. So when you set the CPAP to 5 liters of oxygen, you are managing the pressure that way as well. So any increase in oxygen is going to result in an increase in pressure. This is why in the capnography video, I made sure to mention that if you're feeling like your patient just maybe needs a little bit more oxygen contact, but not necessarily more pressure, you can actually just take these end-tidal nasal prongs and hook them up to oxygen as well. So they've got a little bit of additional gas, but not the pressure that is going to cause that anxiety. So just to take a quick close-up look at these CPAP masks, because I know that this causes a little bit of confusion. There is what looks to be a little bit of a gauge on the orange portion here. So I mentioned earlier that these masks are super convenient in the set it and forget it type sense. We don't have to set the pressure, just the oxygen. The only reason that this is here on this orange portion is actually because there is an optional port here for attaching a manometer if we desired to have one on there. So there's really nothing that needs to be done with this, which is kind of nice. The last thing I'm going to mention with these is just anecdotally, I've been told before, I know the question has been asked at onboarding previously as well, the inline and tidal lines that we have already been carrying on truck, there was a question of whether or not they could just be directly attached to a CPAP mask like so. And the answer is actually no. This is more or less just going to give you a great big blob of a waveform. That's not going to be helpful to us. So if you are, which I hope you are, wanting to get end tidal readings on your respiratory patient with CPAP on, you're going to have to use this end tidal. The last thing that I'm going to mention is med delivery for these respiratory patients. So if you have, let's say, CPAP on an asthmatic patient and they are ready for their second dose of salbutamol, we have no way of delivering salbutamol nebulized through the CPAP. There are optional attachments that can be bought, but we're just not going that route at this time. So what you're going to do is you're going to have to, again, talk your patient through this process. And what you're going to do is you're just going to pop the bottom straps off, lift the mask. We can deliver that MDI, big deep breath in, you know, the whole bit with the coaching of the MDI as well. And then we can just sit the mask back down. It's not ideal. It causes a little bit of a disruption in the CPAP. Your patient might have a little bit of a hard time putting it back on. You can turn it down again if you would like to, if that would help them. But unfortunately, that is just really the best we can do with the MDI delivery system. Other than that, there is not really any more additional information that we need about these CPAPs. Like I said earlier, they're super easy to use. And the main key components that you need to remember are just the adverse reactions, the contraindications, indications that we talked about in the video. And if there's one thing that I want you to walk away from this video with, it's please hone your patient coaching skills. This is super useful for a lot of patients. And it's on us as the medics to really try and sell it to them as the way to feel better. Thanks so much, guys. Have a great shift. Please call me if you have any more questions about CPAP.